There's a team that's playing a critical role in the handling of COVID-19 dead bodies or people who die from COVID-19 infections. I have in studio environmental health analyst at the Accra Metropolitan Assembly. He's also supervisor for COVID-19 burials. Mr. Joseph Asitanga is my guest. Mr. Asitanga, you're welcome.
Thank you.
Okay, it's good to see you. Well, before I start my conversation with Mr. Asitanga, let's go on Zoom and speak to Brighton Misa, who is chairman of the NGOs in Health. Mr. Misa, good afternoon. Hello, Mr. Misa.
Good afternoon, my sister.
Great. Thank you very much for your time.
Good afternoon, and good afternoon to your viewers.
Great. So let me take your brief comment on how Ghana has handled our cases so far. Also, your thoughts on the education we're putting in when it comes to vaccinations and getting people to, out of their vaccine hesitancy mode.
Yeah, thank you very much, and then good afternoon to your viewers. So, Ghana has done well from the beginning, just that it's rather unfortunate our numbers has begun shooting up, and even now it's going down again. In last year, we look at how the Ghanaian government, arranged its protocols for Ghanaians to comply with, and we were able to manage the COVID very well. It's rather unfortunate after the political season and Xmas and other celebrations, we have to our numbers have to shoot up. But now we were expecting government to go back to the same strategies it used to manage the COVID in the previous year, just last year, 2020. But unfortunately, it has to loosen the strategies in a way, and I believe that is one of the reasons why it was catching up with us faster, even though we are experiencing a new variant. So to us, we expected that government would have strengthened or tightened the restrictions rather than leaving it the way it is now. And then we also expected to hear more of the fortnightly briefings that he was giving us. That notwithstanding, I think now people are beginning to protect themselves the better than we used to see. They are seeing how the vaccine is, the virus is catching up with us much faster. And then government is also preparing to deploy the vaccines probably by the end of the month, and it's a good thing we are looking out for.
Okay. Well, hang on for me. Let me come into the studio and have this conversation with Mr. Asitanga. So, Asitanga, we used to see you a lot with my colleague, on the cleanliness of our markets and our other public spaces. Now, COVID presents a much more, a different challenge, essentially. How has it been so far?
Thank you, and good afternoon to your listeners and Ghanaians as a whole. The COVID, it has been really a challenging situation throughout the onset of this particular infectious disease. And we, as officers trained to handle this particular pandemic, when it comes to the end solution of death, has also taken it up as our duty to ensure that we also handle our sector very well. So we've been working hard to ensure that our part is also played out very well.
We have a little clip that we play of you. Usually, in that particular clip, on radio we do. In that particular clip, you talk about
COVID is real.
Yeah, you tell people that it is real. Do you get the sense in your interaction so far with the public that it is still not real to some people?
Yeah, even one is at a point of picking the dead bodies for burial. Family, relatives do not even believe that it's COVID that kills them. So the perception out there is still there that the COVID is not there.
And in that case, how do you convince them, or how do you get them to release the bodies to you so you can go ahead and do your job?
The family, the moment the person passes on, the family has no control with the body.
Okay.
Because the moment you pass on, directly the information is passed to the family members to get to the assembly to do the necessary process of registration. And from there, at that moment, you have no control over the body. We take absolute control of the body.
Okay.
And from that day till the time we're going to carry out the burials. And we invite them and we ask them to give us a date of their choice for us to fix it among our burial days to carry out the burials for them. So when it comes to that time, when most of those who resist and trying to challenge the cause of death, what we do is that we gather them, sit them, take them through counseling, and use the cause of death document. We tell them, the doctor cannot label your relative that he died out of COVID for no reason. And there is no price attached to the medical officer labeling your relative that it's COVID that killed him. But you need to believe that the COVID is there, and that is what has killed the person. There's no reason for you to come to argue with us here that your body is not a COVID body, and we are trying to take your body as a COVID body. So sometimes it becomes a very tough time with us, even with some of the family. We heckle at the morgue when we want to take the body out as a COVID victim to go and bury.
Is that process not endangering both you and the family members? Is there a smoother way we can do this?
Yeah, the smoother way we can do is always the initial counseling we give them. When they come to do the registration processes, we talk to them. Our Director of Public Health, we have a team that when you first come to the office for the registration, we sit them, give them some little bit of education, a little bit of consolation, and then let them understand that the issue has already come, so we have to bear with it.
Yeah.
And then most of them, at least at certain levels, they understand and they comply with that.
More than 500 people. We're getting close to 600 people now who have died. I'm wondering, are your people, you and your people, the ones who buried all of these people? Then means that you have a very large group.
Yes, I have a team made up of 3 burial teams.
Okay.
And each team, I have 9 solid, strong men per each team. Ladies, 5 per each team. Okay. The ladies handle our PPEs. Okay. We do the necessary work. When we need any equipment that we need, the ladies handles that. Okay. And then at the end of the day, every team, we distribute them among the health facilities to convey the bodies per the number of bodies in each of the health facilities. Okay. And that's what we do.
In a day, how many bodies, for example? Or if let's make it a week?
The numbers varies. Okay. Sometimes we have emergency burials, especially this our sister and brother Muslims. When it happens to them, we do not compulsorily fix them on the normal burial days that we have fixed.
You have to bury immediately.
As can be here, a case will come when I'm called upon, get the Muslim team ready to move to pick the body, to go and bury. So in a day, for instance, last week Thursday, we buried 9.
Just last week Thursday?
Thursday.
9 people?
9 people.
They all died on the same day or different day, the same week?
No, not the same week. In a week, we register them in a week. And when we register you this week, we bury you according to the time you've come to register. First come, first serve. Wow. So we give the timetable. When you register, we ask you and we give you time. This is the period your body is supposed to be at the morgue. So fix your time within this period for us to be able to bury the person, because we will not allow the bodies to stay long in the mortuaries.
Wow. So you usually, sounds to me like you usually have a queue of people waiting to bury.
Yes. Yeah. When we say a queue, the queue is a time, our dates of burials. Yes. We bury Tuesdays and Thursdays. Okay. So we may divide according to the first come first service team. So when you fall within Tuesday you come and your family, before we get to, we notify all of them. Before we get to the morgue, the family members are there. I see. Then we'll do that. The following Thursday, before we get to another team, the family members are there. We'll go and carry out the burials for them.
I see. I'll come back and I want to talk, when I come back to you, Mr. Tanga, I want us to talk about the challenges, what sort of challenges you face doing this work, apart from heckling, having family members heckle you because they don't believe that their family members died from COVID. But let me bring in again Mr. Emisa. Are you there, Mr. Emisa?
Yes, I'm here.
Great. So I just wanted to take your thoughts. We're seeing the number of deaths. and we're hearing the people who work with the number of, with the people who have died. We're seeing the Ghana Health Service itself update its website with the number of people, but it still looks like people don't believe, which is what builds into the vaccine hesitancy. What do you think, moving from here, we can do with the sort of information available to us to be able to convince people if we should?
Yeah, so if we are looking at institutional figures, we cannot say Ghana Health Service are not telling us the truth, but you also agree with me, a lot of people have not done the test, and then they cannot ascertain whether one has died of COVID or not, especially when we are losing families, friends, and relatives in the other parts of the world, let's say in the homes and then outside the facility. Moreover, if even people die in the facility, we have to do autopsy to know whether they died of COVID or not. Otherwise, they are also pushed to the morgue and then buried. So it's only those cases we've been able to test that the service will report on that. And the public would definitely have a consent to say that we are even underreporting the numbers. That notwithstanding, the vaccination or the vaccines that we are receiving by the end of this week is something Ghanaians would have to embrace, because that is the only additional way, or that is the only way we could receive additional protection to the observation of the various protocols that we are complying with now. And let me also say that Ghana has one of the most credible EPI system, and has on top a very good EPI team globally and then in Africa. So Ghana has a very good track record of vaccinations, and that one we cannot, there's no way we can dispute that.
Okay.
So I would only ask Ghanaians to look at this issue, the COVID issue, as a global issue, and everybody is looking at how they can protect its members and then move their economies forward, and then protect their families.
All right.
This is not about politics. This is not about whom you know and so on and forth. Okay. This is about time we have to come together and embrace this whole vaccination, take it, get ourselves protected, and live on. We have seen a lot of people receive it in the world and nothing is happening to them. All the things we see on social media and other places, yes, of course, they are of concern. But what we see now, we have also seen a lot of people, over millions of people who have received it and are living and are getting protected against the COVID.
Very well. Let me come back to Mr. Stanga. Walk us through the sort of challenges you face as environmental health workers who are in charge of burying people who die from COVID-19.
Yes, thank you, Madam. As for the challenges, every working environment, there are lots of challenges.
I know. Yeah. Let's start from the biggest to the lowest. Yeah,
the biggest, let me say, we're constrained with logistics.
Okay.
In terms of mobility, for instance, the burial team, I've mentioned rightly, we do not have even a moving vehicle that conveys us from the point of morgue or from the point of office to the morgue and to the cemetery. Okay, I think I continue to make this as, complain all the time, because it is a serious constraint. We use only the single pickup branded with this Zoom Lion colors, which is for different purposes of use.
Was it donated by Zoom Lion?
It was donated by Zoom Lion to AMA.
Okay.
Okay. And the only pickup we use, that is the only pickup that conveys this burial team in and out per every mortuary health facility that we have to go and pick bodies. Apart from that, sometimes we rely on the revenue bus, mini bus, which is used to convey revenue people for revenue mobilization.
Wait, so you use the revenue mobilization minibus to convey dead bodies?
No, we use it to convey our team members to the morgue, to the cemetery, in and out. But why I'm saying so is, you can imagine that the bus that is used for picking staff for revenue mobilization is the same bus that will take to convey burial team to the morgue and to the cemetery. Let's look at the trend of likely transmission Okay, and all appeals to government to come to our aid by even supporting us with, even if a moving vehicle one, to support us or augment with what we have as the pickup, at least could help make the work somehow smoother for us.
Yeah. So the Accra Metropolitan Assembly is supposed to be an organization that generates revenue by itself. Is the mayor, was the mayor aware of this, and having the organization itself taking any steps to help deal with this problem? This
is a problem not only in AMA, it's a problem cut across the whole country. All the district assemblies that, since the onset of this COVID, majority of the assemblies carry out burials.
And you coordinate all these from here in Accra?
I coordinate.
Okay. So across the district as well, they have issues with vehicles?
They have issues with vehicles.
What you have just told me is the issues you have with Accra, with burying in Accra.
Yes, Accra. And you can imagine even Accra being the largest city that we have. We do not have any means of moving the people to the site of burial. So what can we talk about the rural district assembly?
How do they do it in the district?
The districts, I cannot even talk for them because it's too pathetic. I remember there was a day they had to use a pickup to convey the COVID body. And COVID body is an infectious body which is not supposed to be exposed upon transportation to the point of burial. But they have no option.
So do they also have at least like one vehicle that's dedicated for
They do not.
So how do they?
They sometimes rely on the public.
So if...
Like family members can even donate, bring a car to pick their bodies for them to go and bury.
And the district assemblies, are they aware? What are they doing?
The assemblies are constrained with resources. To be honest with you, the assembly as of now, COVID has come to, let's say, it has now come to be more or less stay with us. So the assemblies with the meager income that they have cannot be able to meet the cost of managing the COVID issues that we are challenged with in the country as of now.
Okay.
So we are appealing that if central government, for that matter, NGOs or any benevolent organization can even fall on the aid of the burial team, every assembly would have been grateful.
Wow. That's logistics, which essentially has to do with vehicles.
Yes.
What other challenges are there?
Other challenges, for instance, was I think that this one I should have even thanked the president for meeting our request for paying us the 50% allowances that he pledged to us.
That has been paid?
He honored us with that payment.
When was this payment made?
It was made early this January, since we started the burials.
Okay.
Yes. So then we have this, our tax relief, which has not yet been effected yet.
Okay.
And they promised effecting it for us. We were promised to be given insurance chapter for all of us who are maybe carrying out this exercise, which I think anybody who is within my team is entitled to free medical care at the East Hospital or Legma. We have accredited health facilities that we can go for medical checkup. So on that aspect, we think that the government have done well for us. So
sorry if I misunderstood this. 50% of your salary as given to you as allowances, that has been done as of January.
Yes.
There are tax reliefs which have not been done yet. And then you have insurance packages that have been given.
Yeah, that one too. Okay,
have not been given.
It has not been given.
Okay.
Yeah.
So is that why over the weekend some of your members in Cape Coast indicated that they were withdrawing their services?
I don't understand. I cannot talk for them for now because we compiled the data and a circular was sent around every region and to district level for them to compile. If you bury every assembly, any number of burials you've done, give us the data, the health facility you've picked the body, who are those who were involved in carrying out that burial. So we deployed that message and people went to all the district assemblies and compiled the data and came. Subsequently, the Director of Public Health, upon receiving those data, compiled a comprehensive report and submitted it to Ghana Ministry of Health, which they subsequently processed for the payment. So for now, even few of our colleagues who did not get their monies, we recompiled those who didn't get to resubmit it. And possibly, we apologize that anybody who didn't get his money, I know the director is working on making sure that everybody money is paid to.
Well, so yesterday we did that story. They said that they were withdrawing their services, and what it means is that the implications are that we'll have dead bodies of people who died from COVID complications piling up in the metropolis, in the Cape Coast metropolis.
Yeah, that one, I think I have not picked up data from that place as when I was coming.
Okay. Give me your final comment, Mr. Asitanga,
yes,
as you wrap up.
What we want to let the general public know is that the COVID, I continue to say the COVID is real. And now everybody should be himself, your own keeper, and protect yourself wherever you find yourself. Because I always say, the virus is something all of us cannot determine its dynamics. So because the scientists cannot determine, nobody knows its dynamics. So the dynamics is left to you
individually to take
protect
the
yourself, take care of yourself.
Just a quick one before you go. We know that as of now, 577 people have died. I want to know how many of that you and your team have buried.
I can talk for, when I was coming, I can talk from January, January up to now.
January
up to
now.
date, yes.
Okay.
So this year, January up to date, we recorded 101 deaths.
101.
Yes, just January to February, these 2 months.
Okay. Do you perchance have the figures for last year, since March?
I've not prepared that total data.
Okay.
And out of this 101, as at Thursday last week, we buried 38 out of the 101.
Okay.
With the youngest being 23 years of age. And I remember we buried 9 years old boy.
When?
COVID. That was late last year.
Late last year?
Yes.
So 9 to 23-year-old, part of the number of people that you have buried. But between January and now, you have buried 101 people.
We have, the 101 is the total deaths recorded. And then total buried is 38.
Okay. Okay. No, the total buried, that was Thursday.
As at Thursday, since we started from January burials up to Thursday, so out of the 101, we've buried 38. So we have outstanding, we take 38 out of 101. We have outstanding about 53.
And that's the number of people you are yet to bury?
We are yet to bury.
Okay.
And we're still counting because as at this morning, we registered almost 6 or 7 deaths in the office.
This morning?
This morning.
Okay, so you know, it's the information seems a bit checkered. I've run out of time, but try and put it together for me. So let's start from January till now. Just put together the figures for me again.
January to now, total number of deaths, 101.
Okay.
Total number buried, 38.
Okay.
Yes.
Yes, please go ahead. Total number buried as of Thursday, 38.
Yes, 38.
Okay, and then you said this morning, as of this morning, you had registered...
6, to my knowledge, as of now.
6 new deaths. Okay. Mr. Stanga, thank you very much. I'm sure that along the line, maybe we can zoom you to figure out whether or not the problems that you have raised have been addressed shortly. So just thank you very much for your time. Let me wrap up with you, Mr. Emisa Nyako, shortly. Your very brief thoughts, as I've very little time at the moment.
Okay. So I would like to educate the public that it is time for us to get a shot of the vaccine, COVID vaccine. It is safe and then it is efficacious. We should protect ourselves. We should protect our family and then get vaccinated. Very soon, the vaccines will be rolled out in the facilities and then the nearest vaccination point. Let's get our shots to protect ourselves and our family and the entire public. Thank you very much. Thank you so much, gentlemen. I've been doing this with Joseph Asitanga, who is an environmental analyst with the Accra Metropolitan Assembly. Also, Bright Emisa Nyako, who is chairperson of the NGOs in Health.